Rosemary, or Rosmarinus officinalis if you prefer the botanical name, is a pretty little bush from the Mediterranean. There's also a prostrate or weeping form, botanically Rosmarinus officinalis variety prostratus. Both types can be used in the same ways, as the only difference between them is the growth habit. Because it's from the Med, rosemary likes hot, sunny positions with a bit of shelter and does not like frost or cold, wet winters at all. It grows best in poor, light, alkaline soil with good drainage, which you've given ample lime. Remember that if you want to use rosemary medicinally, it's important that it is grown organically, so that its properties are not masked and you don't end up ingesting toxic ingredients such as pesticides by accident. In climates like the UK, rosemary has a tendency to die without warning, so it's a good idea to have more than one plant. The best bet is to take cuttings regularly. Any spares can be passed on to friends or the local plant sale. To grow from seed, sow under cover from spring to early summer, barely covering the seed, or outdoors in early summer about a ½ inch or 1 centimetre deep. Put them in their final position in autumn/fall or after the last frost date in spring. In areas with harsh winters, your plant will appreciate being brought into a porch or conservatory when the season turns, or you can cover it with a fleece or a cloche, or rely on your stock of cuttings. Rosemary doesn't like having its roots disturbed, so if you will be bringing it indoors, grow it in a pot from the get-go, potting on as required. A full-sized plant will end up in a pretty big pot. Leaves and flowering tops are collected in spring and early summer as you need them, or you can dry them for later use, or distill them for oil if you're feeling ambitious. After flowering, the traditional advice is to prune plants back so as to stop them getting straggly. This would be a good opportunity to get some drying material for use in the kitchen. It's a slightly bitter herb, but makes a great addition to lamb or chicken if used fairly sparingly, as well as lots of other uses. Before I go on, I need to point out that anybody who suffers from high blood pressure or epilepsy should not use rosemary in large amounts or as herbal medicine. You should be fine using it sparingly in cooking though. Rosemary is pregnancy safe at a maximum dose of 1 cup of half-strength standard infusion per day. Please don't use rosemary oil maceration or essential oil during pregnancy, even diluted, on hair or skin. The normal way to use rosemary is as a standard infusion, made from 3 to 4 teaspoons of fresh or 1 to 2 teaspoons of dried leaves steeped in 250 ml, that's 1 American cup or 8 fluid ounces, of boiling water for between 15 minutes and 4 hours. Then you strain the herb off and discard it before use. You can add honey to make it sweeter if you prefer. Pregnant women should restrict intake of this infusion to no more than 1 cup a day, diluted half and half with water. This infusion is used for headaches, migraine, nervous exhaustion, depression, PMS, indigestion and other digestive problems, including gallbladder disorders. You can also use the infusion as a mouthwash, as a final rinse for your hair to treat dandruff, and as a hair tonic for dark hair. Blondes should use Roman chamomile for this instead. The same infusion can be used externally for muscle pain, arthritis, rheumatism and as a skin tonic. If you suffer from neuralgia, a cold compress made by dipping a clean cloth into a cooled standard infusion and putting it over the affected area will help to ease the pain, although it's unlikely to provide a complete cure. You can make a rosemary oil maceration by filling an airtight jar with fresh rosemary and covering it with good quality oil. Olive oil is good. Go for the cheapest type, or the smell of olives will overpower the rosemary scent. Leave it on a sunny windowsill for a couple of weeks, shaking it every day, then strain it and store in dark-coloured glass bottles. Don't be fooled by this picture. You'll need to use much more rosemary than this to get a decent result. If you don't have time or you can't be bothered, the boring way to make a very similar oil is to use 100% pure rosemary essential oil at a rate of 1 drop to every 2 ml of carrier oil, or 15 drops to 1/8 US cup. Once you've made the oil, you can use it as a hot oil treatment for your hair. whichever you're using, warm up the oil, not too much. Despite the name, hot oil treatments actually use warm oil, and apply it to clean hair, massaging it well into the scalp. Wrap your head in a towel and leave it for 2 to 3 hours or overnight, then wash the oil out with a mild non-medicated shampoo. You'll probably need to do it a couple of times. You can use the same method to treat cooties if necessary. That's head lice for those of us in the UK. The oil will suffocate the little blighters, and the rosemary aroma is also a deterrent. Moving on to aromatherapy, rosemary essential oil is not suitable for use by pregnant women, children under 6 years of age, or anyone suffering from hypertension or epilepsy. Rosemary essential oil is used in aromatherapy to stimulate the lymphatic system, for mental and physical fatigue, and to soothe osteoarthritis and rheumatism. It can either be used by adding a few drops to a hot bath, or mixed with a carrier oil as described already and massaged into the skin, but don't use it on inflamed areas. You could also use a muslin bag of crushed fresh herb in the bath instead of buying essential oil. The massage oil can also be used to help ease the pain of RSI. However, this is not a cure, and you should discontinue the activity that caused the condition if at all possible, or find a new way of doing it that does not use the same movements. If you don't have access to rosemary, I sell dried rosemary and also rosemary tincture and rosemary essential oil in my shop at Fran's Alt.Health.